So, what are the best practices for securing patient data in a healthcare setting? And when it comes to keeping patient data secure in healthcare, I think there's several key strategies that really make a difference. First off, encrypting data. That's pretty crucial. Whether the data is being transmitted or stored using strong encryption methods, and there's a bunch of different ones, AES 256, leveraging SSL. Honestly, we're just ensuring that even if someone intercepts the data, they can't actually read it. And I would say another important practice are establishing access controls. And this means making sure that only the people who need access to certain information can actually get to the information. And this may seem like basic blocking and tackling for a lot of our listeners, but honestly, the things that I see that don't go particularly well in a lot of organizations are the basics, the call it blocking and tackling. So consider some of this just reminders as far as what good looks like in an organization. Now, implementing role-based access controls as well as multi-factor authentication are pretty important, and they can help limit access to sensitive data and reduce the risk of unauthorized breaches. And I would say regular security training, and this is for all staff members, and it's a pretty big deal. And it's essential to educate everyone on how to recognize things like phishing attempts, use strong passwords, and follow best security practices. And this helps build a culture where everyone is aware and vigilant about security. But I think what we need to do is we need to have this security training tailored for each job role. So what I see in a lot of organizations is everyone takes the same security training. I don't think that's working anymore. I think if you have a payroll specialist, they're going to be seeing something every day that's probably payroll related. And the targets against them are going to be very similar. Like, hey, pay this invoice, or I need to do something with the account. Now, if they're just getting kind of the general basic training, that might not be enough. So definitely consider that inside of your training plan. I would say security monitoring and risk management are pretty critical. And this is regularly monitoring for threats. And you can use tools like intrusion detection system, intrusion prevention systems, and then conducting thorough risk assessments. This can help identify and address potential vulnerabilities. And this is before they become serious problems. Regular audits and penetration tests are also and should also be part of your strategy. And of course, complying with regulations. And if we're still talking about healthcare, which I think we will, HIPAA is definitely a must. And this involves putting in place the necessary administrative, physical, and technical safeguards to protect patient health information and stay compliant with legal requirements. A lot of areas that I see organizations struggle have to do with this next one, which is having a well-defined incident response plan. I would say this is a best practice, but that's the word that I want to use, practice. These incident response plans need to actually be practiced with things like tabletops. And really the intent here is that we're going to be prepared to quickly and effectively respond to any data breaches or security incidents, which can help minimize the damage and get things back to normal faster. So, as I like to say, practice makes progress. And making sure your IT infrastructure overall is secure. And this includes keeping all software and systems updated with the latest patches to prevent exploitation of known vulnerabilities. And using things like secure cloud hosting that they have to comply with healthcare regulations. And that's really going to help you boost data protection overall. And I think an important one, since we're talking about data, is implementing data minimization and retention policies. And I think this is just smart overall. And what this means is only collecting and keeping the data that you actually need.